It's 1 year now since the WHO declared coronavirus a pandemic. And during these most extraordinary 12 months, scientists have achieved the incredible feat of creating a number of vaccines to deal with this deadly disease. But they've done so thanks to unprecedented levels of public funding, thanks to the participation of tens of thousands of trial volunteers, thanks to the work of overstretched health services like the NHS here in Britain, and thanks to health workers right across the world. In other words, developing these vaccines, and indeed controlling the virus more generally, has been a collective effort. And yet the fruits of our collective efforts have been handed over to a group of gigantic corporations, some of which are making a fortune off the back of these vaccines. Now that not only perpetuates existing inequalities, it has created whole new, previously unimaginable levels of discrimination, which have shocked the whole world. Truly a vaccine apartheid, as many of my fellow panelists here tonight have described it. And yet I'm sad to say the government of my own country is still putting corporate interests ahead of saving lives on a global basis. Now it's true that the UK Prime Minister Boris Johnson announced at a G7 meeting 2 weeks ago that he would be donating vaccines to countries around the world in order to redress this inequality. Now that might sound generous, and after all, Britain has bought many times more vaccines than we could possibly use. So I've been trying to pin him down in Parliament on what that promise actually amounts to in practice. And what I've discovered is shocking, that the promised donations will not be made until we're absolutely sure that we have no use for any further vaccines here in the UK, something that isn't likely to happen for many months. That the donations will only be taken from the government's share of COVAX vaccines, not from the vast pool of vaccines that we've bought bilaterally. And perhaps worst of all, these might not be donations at all. The government might well expect payment for these vaccines. Now, so much for the largesse of the British government. But should we really be having to rely on charity anyway to achieve the global vaccination rates that, let's not forget, are required to make everyone safe? As the South African government recently told the World Trade Organization, the problem with philanthropy is that it cannot buy equality. Well, that's what we're here tonight to argue for equality and for justice. You can't have equality when power is in the hands of a small minority of the world's population. And you can't have equality when power is in the hands of a small number of multinational corporations. If we want true equality and justice, we need systems change. We cannot allow our remarkable collective effort in this pandemic to be reduced to an opportunity for a few to profit. Vaccine equity matters too much for us to allow privatization to steal it away. And that's why I'm so delighted to be part of this distinguished panel and campaign. We're really building something extraordinary. You know, I remember back in my days as a member of the European Parliament, how difficult it was to get people interested in the minutiae of TRIPS and the WTO. You know, these were just acronyms that nobody understood, trade-related intellectual property rights. Well, thanks to this campaign, we've made it a major news story in just a few months. 66 MPs in the UK Parliament have now signed a motion backing the proposal from South Africa and India for a TRIPS waiver at the WTO. So if you're listening from the UK, please ask your MP to sign it. And so intense is the pressure growing, we might perhaps see some compromises from northern governments this week. And if we do, let's bank it. But let's also keep going for the really big goal, a medical system based on collaboration, on sharing, on putting the health of people all around the world ahead of narrow self-interest. Now, such a health system could transform the world, eradicating so many diseases, transforming the lives of millions of people. That's how big the prize is here. So what you're already achieving is incredible, and I'm really thrilled to be part of it. Good luck and solidarity to everyone.